The recent outbreak of cholera in some northern states in Nigeria is now a source of worry to key players in the country's health sector after curtailing Lassa fever. Even the United Nations health body, the World Health Organization, is also concerned. According to the Nigeria Center for Disease Control, as at the end of May 2018, Adamawa, Bauchi, Borno, Kano, Plateau and Zamfara appeared conspicuous on the list of states dealing with cholera outbreak. Topping that list is Adamawa State. Going by the latest figures from the state's Ministry of Health, the number of suspected cholera cases has risen to 909, including 16 deaths recorded in 2 local government areas of Mubi North and Mubi South.
Since early May 2018, suspected cases of cholera have been reported, affecting 9 wards in Mubi North and 7 wards in Mubi South local government areas. The state government acted promptly to initiate laboratory steps towards confirming whether these were cholera or not. Cholera was confirmed within 1 week of the report of the first suspected case. All sectors of the Emergency Operating Center were activated, including coordination, surveillance, case management, water, sanitation and hygiene, logistics and risk communication.
The government is not handling this alone. The United Nations Children's Fund, UNICEF, and the WHO have been at the forefront of sensitizing the people on the need to live a healthy life. The health officials go from house to house to purify water sources and also enlighten the people on cleanliness. This door-to-door strategy has been able to unmask new cholera cases.
Case finding is very integral in the control of cholera, particularly for outbreak situation like this. We know that cholera is passed, usually the organism that causes the disease is passed in the stool or the vomit that infected patients have. And because they are in their household and continue to pass out this bacteria, they contaminate their house, and before you know it, other members of the family will contract the disease.
The team also visits the Mubi General Hospital, where cholera patients are being treated in isolated wards. The health officials believe their action has gone a long way towards reducing the fatality rate from the initial 17% to 1.7%.
Since we started this active case search, I can tell you that the number of deaths that have been recorded has dramatically reduced, because now we're able to catch those that have the disease even before they become dehydrated and then they begin to develop other complications.
The intervention appears to be yielding the needed results in Adamawa State. Health officials say if such efforts are fully replicated in other affected states, the tentacles of the highly contagious diarrhea disease can be curtailed before more lives are lost to cholera.